My name is Mintu Turakhia, and I am an associate professor at Stanford University and executive director of our Center for Digital Health. We had a great session this morning on talking about risk prediction and risk prevention and some of the new paradigms, challenges, and opportunities that are in the field for us, all of us in research and epidemiology. I spoke on the area of digital health and what this means in terms of an introduction of a potentially new paradigm in how research is conducted. What are the challenges, what are the opportunities, and where do we go from here? First, what we do know is that we are kind of in a phase of what we call datafication. Data is being encoded in every corner of our lives by lots of different stakeholders and owners of that data. And as the technology sector has progressively gotten into healthcare, we now see the overlap and the intersection of that health care and technology. And so a lot of this has been largely due to the advent of the mobile phone, which has extraordinarily high penetration, not just in the United States, but all over the world. And so as we become progressively datafied, what does it mean and what are the opportunities for us in clinical research? How do we leverage the data? How do we leverage tools like sensors and smartphones to collect data for the kind of studies we like to do at scale? And what are the trade-offs that we make when we use those tools rather than take the traditional approach of site-based research, largely seminal in our field in the way Framingham and other cohort studies are done? We also talked about how to test these interventions of technology because, as we all know, technology interventions tend not to work in isolation, just as giving a patient a scale doesn't work so well in heart failure. And how do we test the technology? What are the ways to implement these clinical trials? And how do we take those lessons learned and move on? And so it was a very great session with really interesting audience feedback about the world we are at now and where we're going, both with these new technologies, but also paradigms of computation and statistics that are slowly moving into data science, machine learning, and artificial intelligence.